My name is Margaret Babayan, she, her pronouns. I'm a policy analyst with the Washington State Budget and Policy Center, and I'm going to be moderating today. Before we begin, I want to start by acknowledging that I'm on the traditional land of the first people of Seattle, the Duwamish and Coast Salish people, past and present. I want to honor with gratitude the land itself, and also recognize that all of us across Washington and those of us who are joining outside of Washington are currently on the traditional land of the Native and Indigenous people who still occupy it. Thank you all for joining us today. I'm really pleased to be co-hosting this session with Tasia Wood of the Washington State Physicians for Social Responsibility. Today we'll hear from experts in public health and medicine to help us understand why state budget and policy decisions have such a profound impact on our health and what we can do to support health in the policy response to COVID-19. Next slide. First, I want to just make some housekeeping and accessibility notes. We are in webinar format, so everyone joining us today is muted. We will be saving questions for the end. I encourage folks to use the Q&A feature or the chat feature to ask questions. And I'll note that captioning is available. You can enable it by clicking on closed captioning, and there's a button that should say show subtitle. I want to show some gratitude for our captioner, Danae, who's working behind the scenes to make sure that this is available, so thank you so much. And with that, I'm going to pass it off to Tasia Wood, next slide, who will be grounding us today. Tasia is the Economic Inequity Program Coordinator for Washington State Physicians for Social Responsibility, or WPSR. She leads the organization's Economic Inequity Task Force. Prior to joining WPSR, she worked on health policy research in Toronto and contributed to research projects on the social determinants of health, community-based health services, and issues of inequity in long-term care and aging. Thank you so much, Tasia, for joining. I'm really excited to hear from you.
Thank you, Margaret. Thank you for that introduction and for inviting Washington Physicians for Social Responsibility to join in this important conversation today. We're really grateful to be here. So again, my name is Tasia Wood. I use she, her pronouns. And for those who may not be familiar, Washington Physicians for Social Responsibility, or WPSR, is a 40-year-old health professional-led advocacy organization working to address what we believe are the gravest existential threats to human health: the proliferation of nuclear weapons, the climate crisis, and the vast and widening gap between the rich and the poor. These are issues that affect the lives and health of Washingtonians every day, but they cannot be cured by traditional medicine. Prevention is the only cure. And that is why we dedicate ourselves to policy solutions that ensure all communities have their basic needs met. Economic inequality is a primary determinant of health, and that's why WPSR's Economic Inequity Program that Margaret mentioned in the introduction looks not to the healthcare system for solutions to poor health, but to the economic policies that shape health before people even enter the clinic. We advocate from the perspective that budget policy is health policy. Cash assistance that goes directly to those in need is a health intervention. Public investments in education, food, and housing security are public health interventions. And a tax system that raises progressive revenue to reduce economic disparities is a public health intervention. The health and economic crises driven by this pandemic are not two separate issues. They are very much interdependent, and for the state's policy response to be effective, it must reflect this fact. As of this week, there have been over 68,000 confirmed cases of the coronavirus in Washington state. More than 1,800 people in Washington have already lost their lives. Washington's unemployment rate is at almost 10%, double what it was in June of last year, And with the state facing a revenue shortfall of an estimated $4.5 billion by the end of this biennium, the net worth of Washington's 12 billionaires collectively jumped by 28% in just the first 3 months of the pandemic. These figures are staggering. They represent untenable access on one hand and real human suffering on the other. In the last recession, just 12 years ago, public spending in Washington was cut by over $13 billion between 2009 and 2012. This money was largely taken from health, education, and income support services, the programs most needed to address the structural barriers to opportunity that low-income people and communities of color have faced for decades. These decisions have lasting effects on people's health, and combined with a history of discrimination in laws and policies, it's no coincidence that Black, Indigenous, and people of color have experienced disproportionate exposure to the coronavirus, higher rates of hospitalization, and more severe economic insecurity throughout the pandemic. Austerity will not resolve this crisis. If the past is to be our guide, cuts to vital social programs will not if the past is to be our guide, cuts to vital social programs will only prolong the recovery, exacerbate existing inequalities, make the state less prepared to handle future emergencies, and ultimately jeopardize the health and lives of our residents. The good news is that we can rise to today's challenges. We can commit to policy that supports the health of our communities. We can reform our upside-down tax system so it works for all of us. And we can avoid the knee-jerk impulse to cut funding for critical social programs when they are needed most. And as our panelists will outline today, there are options that allow us to both fund the government and promote health. Every day inside clinics and hospitals, WPSR members see the downstream effects of economic inequity in the health disparities of their patients. And as you'll hear from Dr. Daniel Lowe later on, the impacts of budgetary decisions on people's health are not abstract. They have very real, very direct consequences. So that's why we are so grateful to be here today and to partner with Margaret and the Budget and Policy Center in advocating for a policy response to COVID-19 that will enhance and not further harm the health of our communities. So thank you, Margaret, for having us.
Thank you so much, Tasia, for that really important grounding. I want to up next introduce Giridhar Mallya, who will be talking about state budgets and revenue through a culture of health lens and share important research with us. Giridhar is an important accomplished public health physician, also important, and health policy expert. He joined the Robert Wood Johnson Foundation in 2015 and serves as the Senior Policy Officer for the foundation. Previously, he worked as Director of Policy and Planning for the Philadelphia Department of Public Health, and has clinical experience as well. So thank you so much for joining us. We look forward to your presentation.
Thank you, Margaret, for the wonderful introduction and the invitation to be part of this session today. And my appreciation to Tasia as well for framing the challenge we face so well. You know, I think in this moment, we're asking ourselves a number of questions. Whose work is essential? Whose life is essential? How do we achieve justice and peace at the same time? Are we just going to survive this crisis, or are we looking to come out of this crucible with a new vision for our country and our society? And I think these are the questions that we're really grappling with today. Next slide, please. I'm going to keep going, and I know the slides will catch up with me. Our vision at the Robert Wood Johnson Foundation is that everyone would have a fair and just opportunity to be healthy. And for us, that means getting beyond what people often think of as equality, or everyone getting the same thing, and moving to a vision of equity where everyone gets what they need. That means we have to remove obstacles to health, such as poverty and discrimination. It means we need to create pathways for health, like access to livable wages and high quality schools. And it also means that we need to come alongside people and communities and help ensure that they have agency and power to define their futures. These types of discussions about what our society should look like often start and end with questions about resources. And when we look at state budgets, and I'm just going to keep going with my comments and hope that the slides catch up, but I'm going to do my best without the slides. So I think these questions about what our society looks like really start and end with questions around budgets. But I think underneath budgetary decisions are really questions around what our values are. And we need to make sure our values come through in our budgetary decisions. If we look at what states spend money on, more than half of it is for Medicaid and education costs. These are things that we know improve people's well-being in the short term and the long term. Just behind Medicaid and education spending is transportation spending, and next is corrections. So I think what we see even in the top 4 spending items for states is that there are things that clearly promote health and equity, but then there are also things where we are having conversations as a country right now about how and how much we invest in criminal justice and whether it really leads to justice or not. So these questions around how states spend and what states spend are really critical here. As a public health person, what's really fascinating to me is that there's more and more research showing that state and local budget decisions have real impacts on health outcomes. There's one seminal study a couple years ago that showed states that spend more, relatively more on social services and supports compared to healthcare spending have better health outcomes moving forward. And what we can see, if you could go back one slide. Great, awesome. So what we can see is that states that proportionally spend more on social services than they do on healthcare have better health outcomes in the future. On average, states spend $3 on healthcare for every $1 on social services and supports. That ratio is even higher in the state of Washington. So there's definitely some reallocation and redistribution that's needed in how Washington state spends its dollars. Next slide. It's really hard to tease out in these studies correlation and causation, but one thing that's really important is looking at the whole body of evidence. And over the past several years, there have been additional studies looking at this connection between state and local investments and health outcomes. These findings are pretty robust for a broad range of communities across the country. And we're seeing that the connections between budget decisions and health outcomes are particularly acute for women. And these aren't just health outcomes around disease outcomes, for example, with diabetes or heart disease, but we're even seeing that state and local budget decisions can impact how long you live, people's life expectancy. Next slide, please. Terrific. We, as Tasia mentioned, are in an unprecedented time in terms of state budgets, even when compared to the past couple recessions. This year and over the next 2 years, states as a whole are facing more than $550 billion in deficits. So state leaders are left with very, very difficult decisions. Next slide, please. One thing to keep in mind is that when you look across the globe and across 90 years of history, we can see that large spending cuts during recessions can be bad for our health. This particular book was written by 2 economists, one of whom happens to be a physician, And they looked at historical case studies over the last century of recessions and how countries responded. Generally, what they found, whether they were looking at how Greece responded with austerity measures versus Iceland responding with stimulus during the Great Recession, or if they looked at the Asian financial crisis in the 90s and how, again, Indonesia and Thailand responded with austerity policies and Malaysia responded with stimulus policies. What they find is that the countries that responded with austerity had poorer economic outcomes and poorer health outcomes. And the health outcomes that are particularly important to call out here are mental health outcomes and infectious disease outcomes. In our current situation, we know that those are two really important things when we think about our well-being as a country. Just earlier this week, the CDC found that 1 in 4 young people had considered suicide in the past month. We also know that these negative impacts of recessions hit people of color and disinvested urban and rural communities harder than they do everyone else. So what do you do in an environment like this? If you could just give another click here. What the research found is that, great, awesome. What the research found is that countries generally did better if they had very strong baseline social safety nets in place, if they had a vigorous social and economic policy response, and then they made sure that resources and supports were made specifically available to Black and Brown communities. We know this is playing out in the context of COVID as we know that many undocumented immigrants and mixed status families are not able to take advantage of many of the federal responses and even state responses that have been put in place, and that Black Americans have been systematically disadvantaged from receiving small business loans or even cash stimulus payments. Next slide. This idea of racism as a public health crisis has really gained traction. Studies have said that race is a determinant of outcomes, and that race is connected to genetic differences, which we now know are completely false, or even behavioral differences. But those things really obscure the fact that it's not race that's a determinant of health, it's racism. Racism at the interpersonal, institutional, and structural levels. And this is the thing that public health and folks in medicine are finally recognizing and taking action on. Next slide. So how do you budget wisely in times of economic crisis? We've already gone over a couple principles, but I want to highlight just a few others. So I wrote here that we have to remember that this is a dual crisis, but there are actually 3 levels of a crisis here. First, we had a health pandemic that led to an economic recession, and now that's leading to another health crisis, right? Particularly in terms of people's mental health. So responses that may have been successful or not so harmful with past economic recessions here could be harmful because we're dealing with multiple threats at once. Second, we know that states and cities can't do this on their own, and we need to continue advocating for a durable and robust federal response, particularly in terms of state and local aid. Next set, please. In our process of designing strategies, we need to make sure we are measuring impacts across different populations. Washington State, particularly in terms of its COVID data, is doing a really nice job with this. But unless we know what the differential impacts are across populations, we can't design strategies that meet those needs. Next, we need to make sure that those most directly impacted by decisions are helping shape those decisions, and that we don't benchmark our progress based on how the average person in our state or community is doing, but rather based on the outcomes of the most disadvantaged. So what's happening in terms of COVID outcomes or other health and social outcomes among people in nursing homes, among people in prisons, among those who are undocumented? If we are serving those folks well, we are serving our community as well. Next set. Lastly, we need to prioritize the spending that matters most. Public health spending, food and rental assistance, direct cash assistance. We need to remove regulatory barriers to social service programs like SNAP, or even the ability of cities to establish municipal broadband, which we know is just a lifeline right now in our current climate. And lastly, we need to look for ways to raise revenue progressively and judiciously. Next slide. Washington State, unfortunately, is known for having the most regressive or upside down tax system in the country. What this slide shows is that people with the lowest incomes pay nearly 18% of their incomes towards state and local taxes, whereas those with the highest incomes pay only 3% of their incomes towards those taxes. This is for a lot of reasons, but two big drivers are that there's no personal income tax in the state of Washington, and the state relies to a great degree on sales taxes, which we know hit poorer people harder. Next slide. Upside down tax codes don't just harm lower income populations based directly on the economic impacts, but we also see that in these types of tax systems, there tends to be an over-reliance on fines and fees, particularly in the court system. This can lead to additional fees and surcharges and get people in a huge amount of debt. And many states and communities use that debt as a rationale for suspending people's licenses, suspending their voting rights, and unfortunately, incarcerating them in various ways. And we know all these implications of fines and fees are felt disproportionately by people of color across the country. So these upside down tax codes have short and long-term implications for equity in our community. Next slide. There are many, many ways to make our tax code fairer. One of them is through an earned income tax credit. Basically, this is a way for low and moderate income working families to get money back through the tax system. Years and years of research show that this is an economic home run in that it pulls people into the workforce, reduces poverty, and gives children and families who receive the EITC a better trajectory over their life course. We've also found that the EITC has profound health impacts, and those work through a number of channels which are shown here in this slide, through increased income, better educational outcomes, and increased rates of employment. I just want to call out a couple impacts of the earned income tax credit that I think are particularly relevant to our conversation today. We see that earned income tax credits can reduce racial disparities in birth outcomes. They can lead to lower rates of suicide, and they can also reduce household overcrowding. So when you think about it, if you give people cash to use on the things that matter to them most, they're going to put it to good use. And they're going to put it to use in ways that can actually help contain this pandemic. Next set here. 29 states plus Washington, D.C. currently have an earned income tax credit. You'll see that Washington is highlighted as one of those states, but the EITC has not yet gone into effect, even though it has been legislatively authorized. Next slide. So I want to close with this quote. It's written by, said by a pathologist from hundreds of years ago. And it's rare that we quote pathologists, but I think this one is particularly apt. Medicine is a social science, and politics is nothing but medicine on a large scale. So what that means to me is that our decisions, whether we're making them in a clinic or in the Capitol, have consequences for our health and well-being. Let's make sure our decisions bend towards giving everyone a fair and just opportunity for health. Thank you.
Thank you so much for sharing about the population health and community level health impacts of state policy and budgeting decisions. Giridhar, we really appreciate it. Our next speaker, Danny Lowe, is going to illustrate what this means in the lives of his patients. Daniel, or Danny Lowe, is a family medicine physician at a federally qualified community health center in King County. He's written extensively on health inequities and also serves on the board of trustees at the King County Medical Society. He's also, as I noted earlier, a member of WPSR. Thank you so much for joining us. We're really pleased to have you.
Thank you so much for having me here today, and thank you for that introduction, Margaret. It truly is an honor to have the opportunity to speak to you all about this important issue. We can certainly see from Dr. Mallya's presentation how policy decisions impact our communities on the macro scale, but I also want to talk about what that means on the individual level. As Margaret mentioned, I'm a family medicine doctor in a federally qualified community health center in King County. Each day, I see patients struggling to survive the COVID-induced economic miasma. Within a single week in May, I diagnosed 3 separate patients with metastatic cancer, each of whom had delayed coming to the doctor due to a need to find work and to avoid medical copays. If these cases were identified earlier, they may have been treatable. While these heartbreaking examples may represent the extreme, more mundane examples highlight the ubiquity of the economic crisis on my patient's health. In fact, the urgency to act may be best explained through the seemingly banal experience of 2 patients I recently saw in clinic. The first is David, a longtime patient of mine who, despite multiple medical problems, has been an exceptional model for taking ownership of his own health. David is in his mid-60s. He's been deaf nearly his entire life and lives with diabetes, high blood pressure, obesity, and high cholesterol. He lives alone, priding himself on his independence, despite the fact that he requires a walker to move around. He takes nearly a dozen medications a day, sometimes multiple times a day, to optimize his chronic conditions. And he does quite a good job of it. He's never missed a clinic appointment, and for the last few years, his blood pressure has been right at goal, as has his blood sugar, neither of which are easy things to do. He receives benefits from the aged, blind, and disabled program in our state, as well as from the Housing and Essential Needs program. With this assistance, he generally does pretty well for himself. One day this past April, though, one of the front wheels on his walker broke. At the time, I was unaware of this, but it made him completely immobile. And due to COVID and his existing comorbidities, he was understandably scared to have others come into his home to help out. Simultaneously, he needed to get to the pharmacy to refill his insulin. He started to ration the insulin that he had left, awaiting for the next cash assistance deposit so that he could fix the wheel on the walker and get his medications. When I eventually heard about this, his blood sugar was all over the place, and he was a day or 2 away from hospitalization or worse. Fortunately, we were able to get him his medications, and his walker was eventually fixed with funding from our state programs. Without these programs, David likely would have ended up in the hospital, incurring tens of thousands of dollars in costs and jeopardizing his health. Now, David's story isn't too dissimilar to that of Abdul, one of my patients who I saw the same day as I saw David. Abdul's in his early 40s. He's an Uber driver and the father of 3 energetic kids. He's physically strong, but suffers from post-traumatic stress disorder due to events he endured during the war in Somalia. During COVID, Abdul struggled economically as far fewer people have been seeking rides with Uber. He's found himself working longer hours and with less consistent pay. As a doting father, he expressed to me how difficult this is for him. He prays he doesn't bring COVID home to his kids from giving a ride to one of his clients who might unknowingly be infected. And more acutely, he fears not being able to appropriately provide for his kids. With the SNAP program, he tells me, at least for now, he can guarantee his kids get consistent meals. But he fears he's spending too much time away from his kids, needing to work, and that as a result of that, perhaps he makes them feel neglected, something that he is all too aware of himself when he was forced to flee Somalia at a very young age. He's trying his best, and his kids, who are also patients of mine, are currently managing okay. But given the challenges they face, including the racist and xenophobic structures that limit many immigrants' economic growth opportunities, they're at risk of not realizing their full potential. SNAP is critical to their ongoing safety. I highlight these two cases simply because they are very typical cases. These are the patients I have the privilege of seeing every single day. They're remarkably resilient. I learn compassion, community, and grit from them each time I'm blessed to be invited into their lives. But their own resilience can only take them so far. Without programs like those for the aging, blind, and disabled, or housing and essential needs, David would not be able to effectively manage his diabetes and other chronic diseases. Without SNAP, Abdul and his kids would lose the opportunity to have the healthy and productive lives they deserve. I understand that money is tight and that our representatives in Olympia are stuck between a rock and a hard place. Clearly, there's need for social service investments, and simultaneously, I think we can all recognize that we have limited funds. There aren't easy solutions, and as a state, we will have to make tough economic decisions. But as someone who works day in and day out with those too often excluded from opportunity, I find it disturbing that the phrase, "we have to make tough choices," always is used as a justification for squeezing people with low incomes, rather than ensuring that the ultra wealthy and corporations are paying their share of state and local taxes. Why is making tough choices disproportionately, in fact, almost exclusively, used to defend policies that hurt people with low or no incomes? We should appreciate that investing in these types of programs are not just about economics. They are also imperative to health and well-being. These programs are investments in people. They acknowledge the dignity that David and Abdul exude every single day. So when we are forced to make tough decisions, I urge us to remember David and Abdul and ask ourselves, who should bear the brunt of these tough decisions? Thank you.
Thank you so much, Danny, for sharing about your patients and what you see in a very clinical setting. I grew up in a community of low-income Armenian immigrants, and I saw that kind of impossible trade-off between healthcare decisions and also just day-to-day life every single day. And these types of stories that we hear about people making these impossible trade-offs about their health and well-being are not rare. They're actually pretty common. They were common before the pandemic, and they're only becoming more and more common now. We've heard over and over again that the pandemic is laying bare existing inequities, and that's true, but it doesn't have to be. As we've heard, public policy interventions can minimize pain for a lot of people and reduce growing inequities. I'm going to transition from moderating to representing the Budget and Policy Center's policy response to COVID-19. For those of you who aren't familiar with our work, the Washington State Budget and Policy Center is a policy shop. We use research and analysis to advance the well-being of Washington communities and improve the economic security and social opportunity of all in the state. Slow down. In March, we consulted with our partner organizations and community leaders to develop a set of principles for state leaders to consider when crafting a recovery plan to COVID-19. 5 principles surfaced from these conversations, and they actually align really well with what national experts are saying. And I think that's because communities know what they need inherently. Over and over again, we heard to lead with equity and prioritize the people that are most impacted by the pandemic. We also heard the need for immediate, impactful, and sustained relief. We heard the need to make permanent fixes to underlying structural failures, to implement policy responses rooted in trust and dignity of communities, and to reject a scarcity mindset, because there is enough wealth in the state to invest in the people who help generate that wealth in the first place. These principles helped us craft our own policy response to COVID-19. Next slide. To rebuild an economy that truly includes and serves everyone, state lawmakers need to first bolster community investments that support well-being, second, provide direct cash assistance, and third, raise progressive revenue to ensure that these other policy buckets are possible. Next slide. So Tasia already noted in her introduction that state lawmakers cut $13 billion from the state's operating budget after the last recession. And I understand that at the time, lawmakers were really up against a lot and they needed to make some tough decisions. However, these cuts meant that more than 70,000 working adults lost health coverage, 20,000 people with disabilities lost income support, 50,000 seniors with low incomes lost prescription drug support, and so on and so forth. Those cuts came at a time of increased needs. And nationally, we saw population health decline with regards to indicators ranging from increased blood pressure and declining mental health. And of course, unjustly and unsurprisingly, the worst outcomes were for people of color, those without college degrees, and people with low or no incomes. In Washington, from 2007 to 2011, the number of families with children in deep poverty increased by 30%. So 15,000 additional families across the state experiencing deep poverty in that time frame. Black families, more specifically, fell further into poverty, with deep poverty rates spiking more for Black families than for any other group. And families of color were also the most likely to lose accumulated wealth. And during the last recession, we also saw outsized impacts for rural communities in Washington, where unemployment rates spiked much higher than for urban communities. We cannot cut our state budget again this time around and expect different outcomes. Earlier this year, state agency leaders were asked to submit by the governor's office across the board cuts. Similarly to what happened after the Great Recession, if these cuts manifest, it could mean the elimination of nursing home and home care services for tens of thousands of seniors and people with disabilities who are already at risk and vulnerable to COVID-19. It could also mean cuts to financial aid for college students that are low income and who may already be struggling to get the tech and the broadband access that they need to attend classes remotely. These cuts could mean elimination of the already under-resourced Housing and Essential Needs program for people with disabilities who are experiencing homelessness, and is actually a program that some of Danny's patients are accessing. It is a public health imperative to protect these investments, but obviously we also need to make sure that the state has funds for robust contact tracing, for disease surveillance systems and healthcare. But as you heard, states that spend more on non-direct health investments like education, recreational programming, and income supports have better health outcomes. Another example is that during the last recession, families with children that received SNAP, so food assistance, were in much better health than their counterparts who were not receiving SNAP, but that were eligible. We also need to acknowledge that not all public spending is uniformly good. And I just want to note that there are areas of the budget, for example, prisons and policing, that disproportionately harm Black and Brown communities. In Washington, we spend a higher proportion of our budget on prisons and policing than we do on investing in the economic security of people. This is where policymakers can really live into the principles that I outlined earlier and listen to communities on where to redirect and reinvest funds. Next slide. The second policy response bucket is to provide direct cash assistance. We've heard over and over again how meaningful direct cash transfers are to people in poverty and people struggling to get by. When people are not worrying about paying rent or eating or where they're going to get their next meal, they just do better. So we need to reduce barriers and expand cash assistance programs that exist in the state. State leaders have already recognized this and authorized the Disaster Cash Assistance Program. They also made changes to TANF/WorkFirst, so temporary assistance for needy families, to make it a little easier for people to access benefits. But there's still so much work we have to do to make sure these existing programs are accessible and can fit the scale of need. Another very important policy that Giridhar outlined was the Earned Income Tax Credit. As we heard earlier, in Washington State, we have an Earned Income Tax Credit on the books, an expansion, but it has never been funded. And what lawmakers can do right now is fund our state's version of an expanded EITC, so a recovery rebate or a working families tax credit, to ensure that people can have an income boost back in their tax returns when they need it. And this is particularly important because after the last recession in Washington State, we saw a pretty sharp increase in the proportion of people claiming the federal Earned Income Tax Credit because incomes dropped after the recession. What's really notable about our state's Working Families Tax Credit expansion is that ITIN filers are included. That stands for Individual Tax Identification Number. People who file taxes with an ITIN can include undocumented immigrants who are choosing to pay taxes, and this group of taxpayers is included from the federal version of the credit, and our state's policy ensures that they are included, but we need to ensure that lawmakers fund and pass these policies. We also know that undocumented immigrants pay more than $300 million a year in state and local taxes in Washington, and we did an analysis that found that undocumented immigrants were excluded from more than $700 million of federal aid through unemployment and stimulus payment. Earlier this month, Governor Inslee announced a $40 million investment in a one-time disaster relief fund available to undocumented immigrants. And this is a really hard one and important policy that community members were advocating for. It's important, and we need to remember that the initial ask was for $100 million, and that long-term advocates are really pushing for a long-term unemployment insurance system that is available to undocumented immigrants who are paying into the system and getting nothing back. Next slide. And obviously, we need to find a way to pay for and sustain the investments that I outlined. Federal aid to the state and to tribal governments is really critical, but unfortunately, as we've seen, we can't rely on federal leaders. So first things first, we need to fully tap budget reserves. Now's the time to do this. We have a rainy day fund for emergencies, and as my colleague so aptly put it, it is raining. We also need to repeal limits on raising revenue. For example, we have two property tax limits in Washington that do the most damage. The 1% levy growth cap that keeps property taxes from growing in concert with community needs. And the second is a constitutional $10 limit on all regular levies. And this really harms local government's ability to raise funds. To offset these increases, lawmakers should enact a safeguard rebate program and ensure that taxes are manageable for low and moderate income homeowners who may be struggling to keep up with mortgage payments right now. And as we've all noted throughout this presentation, our state's regressive tax code is the root cause of many of the problems we face today. Because our state tax code is so regressive, we've deprived the state of the revenue and resources needed to respond to this crisis, while simultaneously putting an increased strain on people with low incomes. There are options that we can implement to ensure that the wealthy are paying their fair share, because as Tasia noted, wealth for our 12 billionaires in Washington increased by almost 30% in the first 3 months of COVID-19. So we can do things like passing a capital gains tax, for example, which would generate $800 million in its first year of implementation. An excessive compensation tax on salaries more than $1 million could also generate about $300 million. And raising estate tax rates and closing loopholes in the estate tax could also bring in about 130 million. And these are just 3 of the options. There are so many more you can read about in our new brief. Next slide. Our new brief is called Investments Today Can Lead to Better Health Tomorrow. We cite a lot of the research that you've seen in this presentation today, and also go into more detail about some of the state policy options that we can leverage to respond to COVID-19 in an inclusive and equitable way. As Danny noted very eloquently, why is it that the tough choices that lawmakers have to make, why is it that those choices fall on the backs of people with low or no incomes? We really do have enough wealth in the state to generate revenue needed to avoid the worst of cuts and to make these investments. And I'm going to implore lawmakers and advocates across the state to really make sure that we do avoid taking an austerity approach to this recession, and that we do invest in the people that really drive Washington. So with that, I'm going to switch over to our Q&A. I really want to thank Madeline, who helped us out. Madeline Krasp, my colleague. We had some technical issues with the Zoom, so thank you all for bearing with us as that happened. Also, thank you so much to Tasia and Danny from the Washington State Physicians for Social Responsibility. I really appreciate you just really bringing in that clinical lens. Giridhar, thank you so much for joining us with the Robert Wood Johnson Foundation. We appreciate the support, and that national research is just so important to understand. I noted in the chat, we're gonna make the recording and slides available after the webinar, so look out for that in your inbox within the next week. And with that, I'm gonna go ahead and ask for folks to drop their questions into the chat box or use the Q&A feature. Okay, just a moment. I have a question for Tasia and for Danny with WPSR. We're wondering if you can do just talk a little bit more about the work of the Economic Inequity Task Force and the work that you do as physicians on the ground every day.
Sure, thank you for the question. Are you hearing me okay? Okay. So our Economic Inequity program is our newest program at WPSR. And it's an area that our members have been interested in and have obviously seen the effects of economic inequity in the clinical setting. And when COVID hit, we really realized we needed to sort of expedite the development of this program and convene a formal task force, which follows the same model as our 2 other programs on climate change and anti-nuclear weapon proliferation. So we have a wonderful task force of folks who both are representing sort of multiple different roles within the healthcare system, as well as folks like Margaret, who are coming more from a policy perspective. And our main goal is to really lift up the health voice and to make clear that economic policy is health policy. So our focus right now really centers on progressive revenue, tax reform, but we're also very committed to investments like Margaret has outlined that improve folks' health, as well as increasing access to opportunity. So we're a newer task force. We have new members joining us. So if folks are interested in our work, then I would encourage you to look at our website, as well as follow up with me, and I can put my information in the chat. And we'd love to hear from you. So I don't know if Danny wants to add anything else from your perspective, why you as a health professional joined our work.
Yeah, I mean, I can be brief here, but basically, in particular, working at a community health center, so many of our patients, the impacts of income inequalities impacts their health. And some of the examples that I highlighted today, I think, speak to that. And things that looking to do clinically may include, even just screening for folks if they, there's a program based out of Ontario in Canada that does this, asking about if folks struggle to make ends meet at the end of the month, being able to connect them with social services that may help with that. Secondarily, trying to partner with places like United Way or elsewhere who can help with filing taxes. We're talking right now about the earned income tax credit. Nationally, 20% of people who qualify for that don't actually claim that credit. So I think there are opportunities clinically when we are seeing patients and how this sort of thing actually impacts their daily life, where we can step in and be that link in this process to help achieve better outcomes.
Thank you so much for that overview. Really appreciate the important work you're doing to mobilize people in the healthcare sector. I also have a question for Giridhar. Can you speak to the role of philanthropy in this moment? Obviously, you're representing a foundation and are speaking here on policy solutions in health.
Sure. I think foundations have a special responsibility in times like this. In some ways similar to the government, where there needs to be counter-cyclical spending, right? If society and individuals are struggling economically, then that's where government and the private sector, including private philanthropy, need to step in. One of the things we did is reorient our systems to get grants out more quickly, to provide flexibility to grantees, including providing general operating support, and nationally getting out about $50 million for emergency relief, basically to organizations that could quickly get cash or near cash supports into the hands of people that needed it the most, particularly folks that weren't being served by the federal governmental response. So I think that's a really important thing for us to do. As a public health foundation, we have also redoubled our commitments to a strong public health infrastructure. As many of us talked about, there has been chronic disinvestment in our public health system, and to continue the analogy, not rain, but fire here, we are trying to put out a fire without firefighters. So we want to make sure that there is a strong public health response now, but that we also invest in foundational public health infrastructure so that we can be ready for future threats.
Thank you so much. We're also getting questions asking about how to ensure that communities are included in our state policy response. And also just a quick question on the EITC. I just want to clarify that we have a EITC Working Families Tax Credit on the books, but it hasn't been funded. And as of right now, there's no timeline from lawmakers to fund that credit or to expand the program. So we are working as an organization, we work in coalition with the Working Families Tax Credit Coalition to pass that policy. So you can follow the coalition for updates on that front. As far as including community members in a policy response, obviously policy making, it happens kind of behind closed doors. So it is up to us to really share this information with community members and ensure that we're doing our job educating folks about the legislative process and empowering folks to reach out to legislators. And we also need to be encouraging legislators to really prioritize their own constituents in policymaking, which I know they're doing, but there is a lot of pressure from various stakeholders. So with that, unfortunately, we didn't get a chance to address all of the questions. I will be sending follow-up information and slides and recordings. I just want to give a huge thank you to folks that joined us today. We really appreciate your interest in prioritizing health in the state response. Obviously very important as we face a triple crisis. So thank you so much for joining us, and please reach out with questions. We are happy to answer them. Thank you to our panelists. Thank you to our captioner, and have a great day, everyone. Goodbye.